Welcome to the Red Chair series. It's wonderful to see you. Let's start the conversation.
Great. I'm looking forward to it. And it's been some time, so it's really nice to connect.
It is so great to see you.
I'm excited to talk about a couple of the new projects we have going on.
So I'm Dr. Stacy Fisher. I'm the Regional Past President for the Greater American Heart Board, and I'm very excited to see you, another female cardiologist.
Thank you so much, Dr. Fisher, for the invitation. It's really an honor to have the chance to have a conversation with an expert in cardiovascular care like yourself. So I'm really grateful for this time and chance to chat with you.
Well, I'm so glad you are here. I want to hear a little bit more about how you got into medicine, how you decided to link technology and medicine, and this is such an underserved area of the world right now, and integrating that could really change lives, could improve health, and you're doing that. So I want to hear where that came from and where you're going.
Absolutely. When I was a teenager thinking that I really want to impact lives, I really want to make a difference, and I want to do that through being a doctor. And as I started my journey, I first worked with underserved, underrepresented minorities in South Florida, a place where it was a melting pot of different cultures, different socio-demographics, and social determinants of health. And I started to explore the role of digital health within trying to improve the reach and extend the reach of preventive health services within these communities. And I realized as I was heading to medical school and on to my training that this was a powerful tool that was really going to reshape the way that we as doctors train and provide care. My journey continued and became more personal. Unfortunately, when I was in my intern year, my father was diagnosed with a very rare cardiovascular disease, and it changed my world. I realized what it was like to be a patient, even someone who has a lot of understanding and background and context still needs a lot of help in our healthcare system today to know what's the game plan? What do I need to do to improve my health? And so through the experience with my father and his illness, I really connected with the fact that we can do better, we can do more, and let's use the tools that are right here in our pocket, that are on our wrist, that are part of our everyday life to make health seamless with our daily life.
I am a huge believer in personalized medicine. And I think digitals really give a way that you could personalize very, very carefully to somebody's actual medical needs.
Individualizing and personalizing the experience for each patient is critical. Understanding their risk factors. Ultimately, we're all different. This program is made just for you.
And the investment into really good health is huge from a personal and academic and an industry cause. Because it's really what the bottom line is.
Right.
You know, it's how do we get a healthier population? A healthier population costs less so that you can actually invest more in the technologies to make that happen.
Exactly.
But you're making it happen. What would you tell a young woman who's looking at a science or science technology career? What would you tell somebody looking at that today?
You will hear so many no's, but you cannot give up. You know, as a freshman in my dorm room thinking, I can't wait to be pre-med, and then sitting in a meeting and the first thing that came out of the presenter's mouth, and I still remember this, look to your right, 4 on this side and 4 on this side, they won't make it to med school. And I think that kind of mentality is wrong. We need to encourage, and most importantly, we need to encourage those who haven't been given a chance their entire life. Believe in yourself and do not listen to those who doubt.
I wish I could have heard that and had that support as a teenager.
Right.
Is there anything else you want to say to people and patients who are afraid to get into this technology? Because there are a lot of people that are sitting here saying, this is great, but I'm never going to do it. What do I do with those patients?
It's so critical that we understand how our body's doing. With digital health, it provides an opportunity to know how we're doing in our everyday life. Not just that snapshot when you're in the doctor's office. It's our companion for health to let us know, well, hey, you know, Dr. Marvel, you got about 8,000 steps today, so you better take one more walk because you're trying to get to your goal of 10,000 steps. I also think that it's a way to bring us education. So many times we encourage patients to really learn and engage in what their cardiovascular condition is, whether it's high blood pressure or high cholesterol, learn about it. That's going to make the difference between, can we start to reduce people's risks of having cardiovascular events like heart attack and stroke by being daily committed to health and having a companion to help us on the journey. If you think about it, if our kids can use it, if our grandkids can use it, we can start to figure out how to use it too.
Well, thank you for joining us here on the Red Chair series. It was such a pleasure to have you and to talk to you today. I feel like we could talk for days. And I always learn from you, and I really appreciate that you're bringing the data and the technology to change lives.
Thank you, Dr. Fisher, for this invitation, and our conversations are so valuable to me, and I hope others will also learn from our journeys and be inspired to take on cardiovascular health and their health in more improved ways this year. Thank you.
Thank you.